Hi everyone, welcome back to my YouTube channel, and today we are going to talk about pharynx muscles. So let's start our topic with introduction. Pharynx is a muscular tube that extends from the base of skull to the esophagus, that is C6 level. Its wall is composed of two layers of muscles: outer circular layer, that is constrictor muscles that narrow the pharynx, and inner longitudinal layer, that are the muscles that elevate and shorten the pharynx. These muscles work together to perform swallowing, speech, and respiration control. Classification of muscles. It has outer circular muscles that are called constrictor muscles that include superior constrictor muscle, middle constrictor muscle, and inferior constrictor muscle. Second class of pharynx muscle is inner longitudinal muscles that include stylopharyngeal muscle, palatopharyngeal muscle, and serpentopharyngeal muscle. First, we will talk about outer constrictor muscles, then we will talk about inner longitudinal muscles of pharynx. Outer constrictor muscles of pharynx include superior constrictor muscle, middle constrictor muscle, and inferior constrictor muscle. First is superior constrictor muscle. It originates from the medial pterygoid plate, pterygomandibular raphe, and posterior end of the mylohyoid line of mandible and side of tongue. It is inserted into pharyngeal raphe and pharyngeal tubercle on the base of the skull. Its function is to narrow the nasopharyngeal and oropharyngeal parts during swallowing. It is supplied by pharyngeal plexus of vagus nerve, that is 10th cranial nerve. Second outer constrictor muscle is middle constrictor muscle that originates from greater and lesser horns of hyoid bone and also from the stylohyoid ligament. It is inserted in the pharyngeal raphe. Its function is to narrow oropharynx and it pushes bolus downward. It is supplied by pharyngeal plexus of vagus nerve, that is 10th cranial nerve. Next outer constrictor muscle is inferior constrictor muscle. It originates from the oblique line of thyroid cartilage and side of cricoid cartilage. It is inserted into pharyngeal raphe. Its special features include its lower fibers that form the cricopharyngeal muscle, that is the upper esophageal sphincter. Its function is to narrow laryngopharynx and it prevents air entry into esophagus. Its nerve supply is by pharyngeal plexus of vagus nerve and external and recurrent laryngeal nerves. Then there are inner longitudinal muscles that include stylopharyngeal muscle, palatopharyngeal muscle, and serpentopharyngeal muscle. First is stylopharyngeal muscle that originates from the styloid process of temporal bone. It is inserted in the posterior border of thyroid cartilage and pharyngeal wall. Its function is to elevate pharynx during swallowing and speech. It is supplied by glossopharyngeal nerve, that is 9th cranial nerve. Second inner longitudinal muscle is palatopharyngeal muscle that originates from hard palate and palatine aponeurosis. It is inserted in thyroid cartilage and pharyngeal wall. Its function is to elevate pharynx and larynx. It closes oropharyngeal isthmus. It is supplied by pharyngeal plexus of vagus nerve, that is 10th cranial nerve. Next inner longitudinal muscle is serpentopharyngeal muscle that originates from the cartilaginous part of auditory tube. It is inserted and it blends with palatopharyngeal muscle. Its function is to elevate pharynx and open auditory tube during swallowing. It is supplied by pharyngeal plexus of vagus nerve. Muscle arrangement in the pharynx. The constrictor muscles form a muscular tube with fibers overlapping like shingles. Inferior constrictor muscle overlap middle constrictor muscle, which overlaps superior constrictor muscle. Longitudinal muscle then run inside this tube, thus elevating and widening the pharynx during swallowing. Pharyngeal plexus. They are formed by fibers from vagus nerve that give motor fibers to all muscles except stylopharyngeal muscle, and from the glossopharyngeal nerve that gives sensory fibers to the pharyngeal plexus. And sympathetic fibers are also present there that are from the superior cervical ganglion. Functions of pharyngeal muscle. First function is swallowing, that is also called as deglutition. Longitudinal muscle elevate the pharynx while constrictor muscle sequentially contract to push the bolus downward. Second function of pharyngeal muscle is speech, as these muscles assist in resonance and articulation. Third function is airway protection, as constrictor and cricopharyngeal muscle prevent aspiration. Fourth function is auditory tube opening, as serpentopharyngeal muscle help equalize air pressure. Clinical significance of pharyngeal muscles. First is pharyngeal pouch, that is also called as Zenker's diverticulum. that occur between thyropharyngeus and cricopharyngeus fibers, causing dysphagia. Second significance is nerve injuries, as damage to vagus nerve affects swallowing due to loss of motor supply to the pharyngeal muscles. Third significance is cricopharyngeal dysfunction that can lead to aspiration and esophageal disorders. Fourth function is swallowing disorders significance, that is also called as dysphagia, that is muscle or nerve lesion that impair coordination of pharyngeal muscles. Conclusion of this lecture video. Pharyngeal muscles form a complex and coordinated muscle apparatus that is essential for swallowing, speech, and airway protection. Knowledge of their anatomy and innervation is vital for in ENT, neurology, gastroenterology, and surgery. And this was all about muscles of pharynx. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.